Hello and welcome to the channel. Let's get right into it. We look at why Moholo still owes a public hospital over 90,000. We heard about this at his funeral that took place on the 12th of October when they shared this frustration about the public health system. May his soul rest in eternal peace. I'll be back with the rest of the commentary after this video.
We were very much hurt as a family when we asked for donations of an icon and the public did not respond. And we need to put it out there. And I would like to also acknowledge JJ for the contribution, Professor JJ for the contribution he did on his show. Indeed, we did require 700,000 of surgery. And like I said, we only managed to raise 100,000 out of South Africa. Today is a state funeral. With that being said, the approval only came yesterday, midday. All the resources that you are seeing here were done by the family. At the back of their minds, they still have debts of the private institution that they were at. At the back of their minds, we still have debts of the government institution, the academic institution that was helping Baba to have the second operation. We didn't even know that we pay at government institutions. Mama Nomvula, we were given a bill of 93,000 at a government institution. 93,000. I've never heard of that before. To the artists also that, when they heard about our cries, raising funds, trying to raise funds. That was a thoughtful gesture. Although we stopped you in the last hour, we saw the condition of Baba. Hence, we did not want to continue with the fundraising. But we are very much thankful for your efforts and time.
Yeah. That was a very triggering speech by his son-in-law, who is married to the doctor of Moholo. So he was laid to rest in Randfontein Cemetery in Tshwane. This added, to the sorrow that was felt by the fans and his loved ones as they bid farewell to the icon. We saw other people adding comments such as JJ Tabane, Mzwake Mbuli, Premier Lusufi Panyaza as some of the speakers of the day. I'll put some of the comments from the people at the end of this video. Let us just focus on how is it that they need to pay a bill for a public hospital. Turns out that public hospitals are not entirely free, but they are free for basic health services. So meaning that if you need anything extra, there are terms and conditions. Let's look at what those are quickly. Yeah, shocking as it is. So it turns out that Section 4 of the National Health Act provides for certain free healthcare services for people who don't have medical aid. Like, for example, everyone is entitled to free primary healthcare services at governmental facilities and hospitals. These also include clinics, so those are free for all. But there are some sort of categories that apply further in terms of public hospitals and regional hospitals. Let's look at those. Turns out there is something called a uniform fee patient tariff. So this now talks about the subsidies that you as a patient can receive when visiting a public hospital. So firstly, there is something called a fully subsidized patient, and then there is something called a partial subsidized patient. So with a fully subsidized patient, okay, let's talk about those ones first. So these categories, they are based according to your ability to pay for health services. And in practice, this means that a subsidized patient is somebody that does not have any external funds, which means that there is no other fund or other entity that is legally required by law to pay for their fees, whether it's a job or it is the road accident fund, or it is, if there isn't any other person who is legally bound to pay for your fees, then you can fall under the different categories. Okay, now let's look at those categories. So the first one is obviously the fully subsidized patient. So when you are a fully subsidized patient, which I believe Moholo would fall under, because those are the pensioners. If you are a pensioner, a grant holder of some sort, and are unemployed, you fall under the fully subsidized. That means that the hospital will take care of everything. The government will take full subsidy. But they do say that there is some sort of debt relief for those patients that need it, even if you fall under age 3. But it's upon you to approach the hospital and see if you are eligible for possible assistance with paying the fees. It doesn't mean that you just don't go. If you have money, you can still apply for debt review, but it's up to you. So the family should look into that as well. It is really heartbreaking to see them still suffering even after his passing. We hope that people and Good Samaritans will come through. However, as I said, there were people who had comments about how the family felt entitled to the pockets of South Africans. Some were calling out the ZCC church, the leader of the ZCC church. Some were calling out, the billionaires and saying, why don't you contribute? Which is sort of, I don't know if we could say it is fair on them, because they did contribute almost 100,000. And at that time, they had not planned that they would need to make such a contribution. Some were saying that, look, if you're an artist, look after yourself. But the family did say that they did put Soli in a private hospital, but that did not. It's a system. Their funds were exhausted. That is why they had to now go to a public hospital. So even if you do have medical aid, there are limits even on medical aid, But the family is still not happy with how they were treated in the public hospital, and that is what led to the death of their father as a result of the infection, which is shocking considering that people have to pay. Haibo, can all those people who have tenders at the hospitals take their jobs seriously, please? We're not sure the details as to which category and which policy was applicable to Moholo's condition that he had to pay so much. Thank you for watching up till this far at this moment. Give this video a thumbs up, and I'll see you on the next video.